Here's a handy technique when you need to place a long span provisional bridge. So in this video, we just cover the provisional bridge. To see the whole case, go to dentistrymasterclasses.com. Click on the blue link in the description below. This is the provisional bridge. This woman's bridge had come loose because you can see there are 4 teeth connected to 2 teeth. And if you place a conventional provisional bisacrylate bridge and the patient bites down here, what's going to happen? They're going to fracture the provisional bridge. So this is the final what we ended up doing with this case was removing this long span bridge because it was loose on this end. And remember, you don't ever want to tap off a bridge. You're very likely to fracture a tooth off in the retainer of the bridge. So you always want to cut off a loose bridge. Don't ever tap them off. There's a story behind that I won't go into right now. So we ended up placing 2 implants and then single crowns on the abutment teeth. But we're just talking about the provisional bridge in this video. So I've cut off the retainer that was not loose, and the other retainer was loose, and then I've re-prepped those teeth, and now I'm squirting my bisacrylate in my polyvinyl siloxane matrix, which was made from a preoperative model. And wet the teeth, prep teeth real well, and squirt this bisacrylate on the wet surface, soppy wet. You want to be sure when you're fabricating this matrix that you have a posterior tooth and an anterior tooth to stop it. If you're doing prepping only anterior teeth, be sure it extends onto the palate so there's something to stop it. If the matrix is only over the prep teeth, when you push it to place, it will go too far and you won't have any occlusal restorative material. So trim that.
Go ahead and get this.
So this part fractured off, so I'm reconnecting it. And that's just flowable composite. Then I'm taking, this is a number 6 long shaped ground burr, and I'm making a cut from here to here on the underside of the provisional bridge. Now this is the provisional bisacrylate bridge, and I'm cutting that deep enough that a paper clip will fit in to that slot. This is just a thick paper clip, and I mark it. This is commando dentistry. And then I'm squirting flowable composite on top of the paper clip, just to strengthen that part, so it's less likely to fracture if they forget and bite something on it. Put that to place. Cure it just a little minute. See, I put the implants in at this same appointment. That's flowable composite, just repairing any little voids in the provisional and making this surface nice and smooth. Be sure you put Vaseline on your suture so it doesn't stick to the bisacrylate or the flowable composite that you're using to repair any little voids. So this is a provisional with the paper clip from here to here, and it's very sturdy. So I hope that's something you can use in your practice. So that's the Dental Minute. These techniques work, and they work every time.